Damn, baby, this rocking chair is nice. I love rocking chairs. It promotes movement, and that's a healthy thing. I'm really just pumping my calves, but more movement is better than none. That has nothing to do with what we're talking about today. It's just comfortable, I don't want to ride in it. The question we had was, how do I know if I should go get cracked? I think that was a great question, and this was somebody who reached out online, of course, because they would probably be in the office already if that's what they were looking for. But the short answer is, well, no, because nobody gets cracked when they come into a chiropractor, right? I don't really care what you call it, but just so you know, it's gas bubbles escaping from the joint when you hear that noise, right? Those nitrogen gas bubbles, they build up in the synovial fluid between the facet joints, and when the joint capsule stretches, they pop, right? So that's what you're hearing first and foremost. Should I go get cracked? So even if you want to call it that, should I go in and get that done? Well, right away, if a chiropractor would throw you on the table, which almost all the chiropractors I know would not do that, but there is a great disparity in the different quality of chiropractic out there, chiropractic care. You probably shouldn't be going to them, right? They don't know what's going on with your body. They put you right down on the table and they start, and it might feel good and it might not, because they haven't done a comprehensive exam. They should be testing your not only strength and range of motion and reflexes and sensation and all that kind of stuff and doing appropriate orthopedic exams based on your history, but having you get x-rays and potentially MRIs based on the history. Now, does everybody need to have imaging done before they would get cracked? Well, no. I actually, I have a few patients that I did not require to get imaging because the history was unremarkable. They reported just tightness. It was really a lot more than that. But getting down to the nitty and gritty after the exam, I realized this person, I'm likely just going to see some mild degeneration. I already know what I'm going to see. If they had any sort of severe pain or a fall or some more complicated history, absolutely we'll see what's going on inside them. Even so, though, before just slapping them on the table for an adjustment, even if they're not getting imaging, we do a very comprehensive exam and often still won't adjust them on the first day. We'll do some myofascial release and we'll see how they respond to something like that. Some mild flexion distraction where we move, at least if they had low back symptoms, right? Where the legs move up and down to open space between the lumbar vertebra and the low back, make room for the discs and the nerves. Some things that are palliative, yet also helpful in loosening the musculature and the tendons and ligaments that surround and attach to your spinal joints, right? Now, should I just go get cracked? Well, even if it's been the second visit or the third visit, I wouldn't purely just do the adjustment. You have to look at things like myofascial release, as we were just talking about. Look how muscles connect to the spine, okay? And you have some examples in the splenius, the band-aid of the neck, they call it. It goes like this around your neck. You have spinalis, cervicis, and capitis, and all these different muscles. The names don't really matter. Levator scapular, right, goes from the shoulder blade up into the first four cervical transverse processes outsides of the vertebra. But if these muscles are neglected, if they're overly tight, albeit the adjustment is moving the bone in the regard that, moving the joint, the spinal joint, in the regard that it can help to loosen the musculature as one of the benefits, right? Aside from taking pressure off the nerves and getting blood flow into the discs and promoting the release of neurotrophins and good endorphins, right? And things of that nature. It's something that should be addressed in itself, is that muscle tightness and any adhesions that are contributing to a misalignment and to pain, right? So I like to address those first so that I can see, okay, now when I feel the spine, I'm feeling what's purely a misalignment in terms of the bone being misaligned, so more so here than just some really tight musculature that's pulling something out of place, right? And even after loosening it and breaking up myofascial adhesions, it still could be relatively tight, but probably less so. This is something that is not just done in a day, it's done over days and weeks and months, and it also requires exercise, right? So should I just go get cracked? No, because we're also going to give you some exercises, right? At least, I would think most chiropractors would. I certainly would. Give you exercises to correct your muscular imbalances, your musculoskeletal imbalances, right? And we talked about that high trap the other day, somebody with that externally rotated foot, and they have overly tight iliopsoas and weak glutes. I had a patient the other day that had that, right? And so we actually went through a lot of those exercises and to correct that. But there's all sorts of things I see all the time. Excessive foot supination, you like I said, one high shoulder, feet that are rotated a certain way, knock knees, all sorts of stuff, hip that kicks out when they walk. And these indicate different muscular imbalances. And so it's also extremely important to me to correct those so that you don't need to see me as frequently in the future to get healthier, to feel better, to move better, right? And so, that's going to be an everlasting effort on the patient's part to improve the biomechanical imbalances, and once they do, they pretty much just have to maintain, right? But, it's definitely something that requires attention. Exercise, myofascial release, there's flexion to stretch, there's a whole lot more nutritional guidance. If your nutrition is poor, right? Let's say somebody eats a lot of added sugars and processed foods. So that can contribute to inflammation and pain. Your nerves are inflamed. You're in pain all the time, right? And so do you think you're going to feel much better from just getting cracked? Should I just go get cracked? No, right? The nutrition is a massive part of it too. So it's this whole all-encompassing, pie where, of different areas of health, and the patient and their health is at the center of it all right? And it's a unique case for every single person. There's no cookie cutter. You come in and you get a thoracic adjustment, a cervical, you get a lumbar adjustment, and some people do qualify for all three of those, a pelvic adjustment even, maybe an extremity adjustment, but some people don't, right? And so the answer to your question, and you know who you are, I hope this was, I hope this was helpful, is, yes and no. That will be a portion of the treatment, but that shouldn't be what you're purely looking for. It should be to correct the dysfunction and dis-ease that's currently going on in your body. So that's what we got for you guys. My sister's going to be home soon, man. The dogs are making noise. Maybe she got home already. If she did, she's got to come in here. Hopefully. What's up, peeps? Who do we got on here? Say what's up to the people. Ivan, how you doing, brother? Jacques Winter. Honey Batty. Honeybee Daddy, how you doing? Israel. What's up, Ma? Happy today. Ashley, what's up, girl? I'll see you later. Salad and Spears. Shelly Belly. How you doing? Forlick. Norman. Wells. Master Malcolm. How you doing, stud? Hot 89. Hey. Aged to perfection. Well, good for you. You're not a fine wine. Sounds like you are. Louis Raphael Photography and Mr. Bill Stretch. As for now, if we don't have any questions, Dave, what's up, brother? Visa East. How you doing? Hey. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an amazing day. I'm going back to the office in a minute. And happy Wen Wellness. Maybe I'll see you there one of these days. Thanks.